Hello everyone, my name is Nancy Bhaskar and the focus of today's presentation will be on tobacco prevention and control, specifically tobacco cessation in teens. Several research studies have been conducted in order to evaluate the efficacy of an evidence-based program known as the Not on Tobacco program. The NOT program is a school-based teen smoking cessation program originally developed by an American Lung Association. It is a gender-sensitive voluntary program meant for adolescents between the ages of 14 and 19. The goals of this program are quitting and reducing smoking. The two study conditions were the NOT program, which involved weekly sessions with trained facilitators, and the brief intervention, which resembled the type of instructions students might receive at a typical school setting, quit smoking advice, and self-help brochures available to the public. Studies regarding this program primarily focuses on whether the NOT program is effective in achieving higher quit rate and reduction rates among teen smokers. The social determinants of health are shaped by political, social, and economic forces. They can greatly influence different areas of public health, including tobacco prevention and control. The World Health Organization defines social determinants of health as the circumstances in which people grow, live, work, and age, and the system put in place to deal with illness. This can include unequal distribution of power, income, goods, and services, unequal access to healthcare, schools, and education, and conditions in work and home settings within communities, towns, or cities. Now that we have a better understanding of determinants of health, let's take a look at how social factors surrounding teen smokers impact the effectiveness of the NOT program. To begin with, low socioeconomic status, which includes low incomes, low levels of education, and unemployment, is one factor that might hinder progress towards tobacco prevention and control. In fact, populations with low socioeconomic status are the ones that have the highest prevalence of smoking and secondhand smoking exposure. Not only that, data gathered from multiple surveys reveal that the Healthy People 2020 goal of reducing smoking prevalence to less than 12% was only achieved for certain populations, such as those from high economic status. Parental influence is another factor that can affect the outcome of the NOT program. Since the NOT program requires the use of informed parental consent, it discourages participants from minority youth. This could be due to the fact that the minority populations have certain cultural norms and values regarding smoking or research. Finally, tobacco industry marketing can have a negative effect on tobacco prevention and control. The tobacco industry has directed the marketing of its products to low-income and minority communities, especially through advertising, as well as promotions and discounts at the point of sale. In fact, poor and minority neighborhoods tend to have a greater number of tobacco realtors. As a result, adolescents within these neighborhoods have less exposure and awareness about the harmful effects of smoking, and making them vulnerable to such marketing strategies. Nevertheless, the developers made sure that the NOT program appealed to the diverse perspectives of teen smokers. For instance, one of the studies evaluating the NOT program involved a matched design rather than random assignment to the two treatment groups, NOT program versus brief intervention. The matched design allowed the researchers to select schools that were already prepared for the NOT intervention, and brief intervention schools that did not have NOT already in place. Researchers selected the NOT schools that were diverse based on school locales, student population size, racial and ethnic composition, student-teacher ratio, geographic locations like urban, suburban, and rural, and economic status in order to come up with a heterogeneous sample of youth study participants. Having said that, this evidence-based program effectively addresses the public health priorities of the community because, along with encouraging teens to quit and reducing smoking, the NOT program seeks to increase healthy lifestyle behaviors and improve life skills such as stress management, decision making, coping, and interpersonal skills. The NOT program brought about the desired change within the community because the study found that the NOT female teens were 4 times more likely to quit smoking 6 months after the program ended than the brief intervention female teens. Approximately 84% of NOT teens quit or reduce smoking compared to only 55% of the brief intervention teens. The result from the study shows that the NOT program could be an effective way for school health professionals to tackle the issue of teen smoking cessation. Proper infrastructure is required in order to improve overall community health. The American Lung Association developed the NOT program and formed effective partnership with school districts and academic institutions. The collaboration between these key players allowed public health professionals and school administrators, school nurses, and teachers to reach out to teens that smoke and encourage them to adopt healthy lifestyle behaviors. At each school, the principal or county level administrator would nominate one male and one female adult facilitator based on their ability to relate to students and their non-smoking status. Coordinators from the American Lung Association would provide free facilitator certification training as well as specific curriculum guidelines and sample materials. Since the NOT program was a community-based group education, the resources used to develop and implement the program mostly included staff and volunteers from within the community who were trained to facilitate group discussions. Another community resource used were the schools themselves, since the NOT program was held within the school premises and conducted during school hours. The intervention is a result of the combined effort of the American Lung Association and offices within the community such as the Bureau of Public Health and the Department of Education. The NOT program is considered one of the successful school health promotion programs due to the strong local interest within school systems and financial support that it receives from the American Lung Association and the CDC's Prevention Research Center. The funding from these organizations provides the necessary infrastructure by supporting implementation and conducting scientific research needed to evaluate the effectiveness of the program. As a school-based teen smoking cessation program, the NOT program involved several ethical concerns, especially in terms of barriers to the recruitment process. Recruiting the right participants is essential for conducting research because it can influence the outcome of the study. However, this process can be difficult when the study involves teen health risk behaviors such as tobacco use. While schools do provide an environment with teens as a captive audience, teens who use tobacco would attend school less regularly than those who do not. Apart from low school attendance, students might not join the program because they are not interested, which could also interfere with the voluntary participation of the NOT program. The NOT program also requires active parental consent, which means that parents have to provide written permission before the child can participate. This is in place to protect the rights of minors. However, this raises concerns about confidentiality because students do not want their parents, school administrators, or friends to know about their tobacco use. This could be because the students are afraid of parental punishment and disciplinary actions from the school administration. There are no obvious opponents to the program. However, lack of administrative or faculty support could inhibit the success of the program. These research partners must be genuinely sensitive and understanding about teen tobacco use to ensure the participants are motivated and willing. There are several political, social, and economic factors that contributed to the need for the NOT program. For many years, West Virginia had one of the nation's highest teen smoking rates. As a result, West Virginia's Prevention Research Center collaborated with American Lung Association to develop the NOT program in response to the growing number of teens addicted to tobacco and the lack of effective tobacco cessation interventions for teens. Since the tobacco industry marketing was specifically targeted towards teenagers, it was all the more important to develop the NOT program and promote its implementation through hard-hitting anti-tobacco mass media campaigns. If I were attempting to get a local community to buy into the program, I would market the program to teens, parents, teachers, and school administrators by providing relevant statistics about the effectiveness of the NOT program. In other words, I would provide evidence about positive smoking behavior changes to suggest that the NOT program is successful teen smoking cessation program. For instance, one particular study indicates that approximately 84% of teens who participated in the NOT program either quit or reduced smoking compared to only 55% of brief intervention teens. Several other studies conducted in the past years are also effective of these results in that they demonstrate higher rates of smoking cessation in NOT teens than brief intervention teens. Furthermore, a study that analyzed the cost effectiveness of the program revealed that students who received NOT were predicted to have an increased life expectancy of 7.46 years compared to the students who received brief intervention. Overall, the NOT program was a successful teen smoking cessation program due to several reasons. The short-term effects of program include increased quit and reduction rates. When assessing the long-term effects of the program, researchers observed increased healthy lifestyle behaviors and improved life skills. In fact, 80% of the NOT participants believe that the program helped them in the areas of their lives beyond smoking cessation, including feeling better about themselves, dealing with better stress, exercising more, making new friends, dealing better with family, eating better, and going to school more often. At the same time, participation in the NOT program may have certain negative effects such as weight gain, depression, digestive problems due to smoking cessation. However, the quality and quantity of life of these teens can be maintained through the constant support from the parents, peers, and teachers and school administrators. In terms of scalability of the program to other communities, the NOT program has been adapted for Native American youth as well. These are just some of the references that were used. Thank you for listening.